Hello friends, we are back and today we are going to talk about muscles of mastication. If you have not checked our previous two videos, they were on development of temporomandibular joint and the anatomy of temporomandibular joint. And today we will be discussing about muscles of mastication. Muscles of mastication are skeletal components of the body that are held together and moved by the skeletal muscles. So they help in movement of mandible, okay, and helps in functions like chewing, talking, etc. So there are four pairs of muscles of mastication. First is masseter, then it's temporal, then it's medial pterygoid, and then lateral pterygoid muscle. Let's talk about the first paired muscle. We are going to talk about masseter muscle, which is rectangular in shape. It originates from zygomatic arch and extends downwards to the lateral aspect of lower border of the ramus of mandible. It also extends from the region of the second molar in the mandible at the inferior border posteriorly to include angle of the mandible. Alright, and this masseter muscle is further divided into two portions, superficial portion and deep portion. So basically a superficial portion, in superficial portion the fibers run downward and slightly backward. In deep portion these fibers run predominantly in the vertical direction, which is shown in the picture. So what is the function of this masseter muscle? Basically, it helps in elevating the mandible so that the teeth are brought in contact. Okay. Other than that, the superficial portion helps in protruding the mandible. So when mandible is protruded and biting forces are applied, the fibers of deep portion stabilize the condyle against the articular eminence. Let's talk about another paired muscle, which is a temporal muscle. So basically, it's a large fan-shaped muscle that originates from temporal fossa and lateral surface of the skull. Based on the fiber's direction and its function, this muscle is divided into three distinct areas: anterior, middle, and posterior portion. So in the anterior portion, the fibers are directed vertically, whereas in the middle portion, the fibers are directed obliquely across the lateral aspect of the skull, and in the posterior portion, the fibers are directed horizontally. Alright, now based on its function, these three distinct areas basically elevate the mandible, but the contraction of anterior portion raises the mandible vertically, whereas contraction of middle portion elevates and retrudes the mandible. Contraction of posterior portion shows elevation and slight retrusion of the mandible. So the temporal muscle is capable of coordinating closing movements of the mandible. Now let's start talking about medial pterygoid muscle. Now this is another paired muscle. Okay, the medial pterygoid muscle originates from pterygoid fossa and extends downward, backward and outward. Remember, it extends downward, backward and outward to insert along the medial surface of mandibular angle. Okay, and along with the masseter muscle, it forms muscular sling that supports mandible at the mandibular angle, and its function is to elevate and protrude the mandible. Now let's talk about another paired muscle, which is the lateral pterygoid muscle. Basically, this muscle is divided into two: inferior lateral pterygoid muscle and superior lateral pterygoid muscle, and it originates at the outer surface of lateral pterygoid plate, extends backward, upward and outward to its insertion primarily on the neck of the condyle. Okay, so it starts from the outer surface of lateral pterygoid plate and inserts itself into the neck of the condyle. Okay, and it helps in protrusion of mandible. Now the superior lateral pterygoid muscle is smaller when compared to the inferior lateral pterygoid muscle. The superior lateral pterygoid muscle originates at the infratemporal surface of greater wing of sphenoid bone, extends almost horizontally backward and outward to insert into the articular capsule, disc and the neck of the condyle. Okay, the inferior lateral pterygoid muscle is active during opening of the mouth and the superior lateral pterygoid muscle is inactive, okay, during the mouth opening and becomes active in conjunction with the elevator muscle. So basically superior lateral pterygoid muscle is active during power strokes like while chewing or clenching the teeth, where it helps in closure of mandible during or against resistance. Alright. We have spoken about masseter muscle, temporal muscle, medial pterygoid muscle and lateral pterygoid muscle. These are the muscles of mastication. But there are other accessory muscles like digastric muscle and sternocleidomastoid muscles which do not influence mastication per se but influences the functions of mandible, that is movements of mandible. So first let's talk about this digastric muscle, which is divided into two portions: posterior belly of digastric muscle and anterior belly of digastric muscle. Alright, so the posterior belly of digastric muscle basically originates from mastoid notch, which is medial to mastoid process. Fibers run downward and forward and inward to intermediate tendon, which is attached to hyoid bone, which is seen in the picture. The anterior belly originates at the fossa of lingual surface of mandible, which is close to midline. The fibers run downward and backward to insert in the same intermediate tendon, which is attached to the hyoid bone, and basically it depresses the mandible and raises the hyoid bone. Now let's talk about the other accessory muscle, which is a sternocleidomastoid muscle. The name itself says about its origin. Okay, now this muscle is a large superficial muscle of the neck which originates at the sternal head. This tendon arises from superior lateral part of the front of the manubrium sterni. Okay, and inserts itself into the clavicular head, that is musculotendinous, which arises from medial 1/3 of superior surface of the clavicle. Okay, now talking about the function of the sternocleidomastoid muscle, it is when one muscle contracts, it turns the chin to the opposite sides. And when both the muscle contract, it helps in drawing the head forward, as in eating or lifting the head.